Welcome to The Explainer. Today, we're looking at how scientists are training AI to find a whole new generation of cancer treatments, the kind that might finally leave healthy cells completely unharmed. So, let's dive in. Let's talk about the biggest problem in fighting cancer. Forever, it's been the collateral damage, right? So many of our best treatments are kind of like using a sledgehammer to crack a nut. Yeah, they go after the cancer, but they also cause a ton of damage to the patient's healthy cells along the way. And this slide really lays it all out. On one side, you've got conventional chemo. The researchers say it lacks cell specificity, which is a fancy way of saying it's basically a carpet bomb. It just hits everything and causes some really tough side effects. But on the other side, we've got a potential new hero in this story, anticancer peptides, or ACPs for short. Now, these guys are different. They have what's called high selectivity. They're like these tiny molecular smart bombs that can actually pick out and target just the cancer cells. And what does that mean? Way less toxicity and way fewer side effects. Okay, so if these ACPs are so great, you're probably wondering, why aren't we using them all the time? And that is a great question. The huge problem is just finding them. It's exactly like the slide says, searching for a needle in a molecular haystack. The old school ways of identifying these things are, and I'm quoting the paper here, stuck with low efficiency, high costs, and technical complexity. All of that creates this massive bottleneck that just grinds the development of potentially life-saving drugs to a halt. And this is where the story gets really interesting. To plow through that giant molecular haystack, scientists are turning to a new secret weapon, artificial intelligence. You see, AI gives them this incredibly powerful tool that can just rip through all the possibilities and zero in on the most promising candidates way faster than any human ever could. So, how does this actually work? Well, it's a pretty straightforward four-step process. First, you gather up tons and tons of data, all the known anti-cancer peptides, and, just as important, the ones that aren't. You feed all that to the AI. Then, step two, the AI starts to extract the key features. It's looking for the patterns, right? The secret sauce that makes a peptide good at fighting cancer. Once it learns those patterns, you get to step three. You train the model. And finally, step four, you unleash that trained model to predict which unknown peptides might be our next big breakthrough. And it does this with just incredible speed. Okay, but here comes the twist. Just when it looks like AI is about to save the day, the very researchers who wrote this paper throw up a major red flag. And this quote on the screen says it all. Most of these models lack interpretability and wet laboratory validation. Basically, most of these super smart AIs have two giant problems. First, they can't explain why they made a prediction, and second, nobody's actually testing their predictions in a real lab. And this gets us to what's famously known as the black box problem. Think of it this way. An AI without interpretability is like a genius student who gets a perfect score on every single test, but they can never, ever show you their work. You see the correct answer, but you have absolutely no clue how they got there. And when we're talking about medicine where lives are literally on the line, just getting the right answer isn't enough, not even close. Doctors, scientists, they need to understand the why behind the prediction. And believe me, this isn't some small academic problem. It's huge. To really drive this home, the researchers looked at 68 different AI models that were all designed to do this exact thing, find new anti-cancer peptides. 68. And you want to guess how many of them had their predictions actually tested and validated in a real physical lab? Just 3. 3 out of 68. That is a massive, staggering gap between what a computer thinks might work and what we actually know works. So, what's the solution? How do we fix this? Well, the researchers don't just point out the problem, they propose a new way forward. And it's not just about making the AI smarter, it's about building a whole new framework, a system that turns AI from a mysterious black box into a partner that we can actually trust, all the way from the computer screen to the doctor's clinic. And this framework they're proposing is basically a complete, verifiable pipeline from start to finish. Step 1 is the same, you build the AI model. But then comes the crucial new part, step 2. You make the AI show its work. You analyze why it made its predictions. Then, for step 3, you take the best of those predictions and you put them to the test in a real lab, rigorously. And finally, step 4, once you have something that's proven to work, you use other amazing biotech to figure out how to turn that peptide into an actual medicine you can give to a patient. So, let's break that down into 3 key actions. First up, cracking the black box. This means using specific methods that literally force the AI to reveal its decision-making process. No more secrets. Second, proving it works. This is non-negotiable. You take the AI's best ideas and you subject them to real-world lab experiments. And third, making it a medicine. This is where you bring in other cutting-edge tools like nanodelivery to make sure that this promising little peptide can actually get to where it needs to be inside the human body to do its job. When you put it all together, what's the goal here? It's really simple: to build trust. The whole point is to move away from a system where we just cross our fingers and hope the AI is right, to a new system where we can actually understand why it's right and then go out and prove it. It's about letting scientists use the unbelievable speed of AI, but with the rock-solid confidence that only comes from real scientific proof. And that really leaves us with a pretty incredible thought to chew on. This whole idea isn't just about making AI a better tool for finding drugs. It's about transforming AI into a reliable, transparent, a trusted collaborator in the fight against cancer. So it makes you wonder, doesn't it? Could the next generation of cancer cares be designed by an AI that we can finally truly understand and trust?